Welcome to the Leading Voices in Food podcast. I'm Kelly Brownell, Director of the World Food Policy Center at Duke University. This podcast is part of a series focused on the far-reaching impact of the COVID-19 pandemic on the food system. Today, we're looking at how the pandemic is driving up numbers of children experiencing or at risk for malnutrition, for wasting, and for possible death. Our guest expert is Dr. Saskia Osendarp, Executive Director of the Micronutrient Forum in Washington, D.C. Saskia, thanks so much for being with us today.
Thank you.
So Saskia, you and your research team recently published an article in the journal Lancet where you presented deeply troubling data on child malnutrition, wasting, and potential death as an impact of the pandemic. First, can you explain to our listeners how COVID-19 directly contributes to child malnutrition and child deaths around the world?
The way COVID-19 impacts child malnutrition is so unique and complex. We are actually facing a triple threat for malnutrition. COVID is putting an extra burden on the health system, and in many countries, health system interventions have been stopped or disrupted. So essential nutrition services that were normally being delivered through the health system, and this includes multiple micronutrient supplementation during pregnancy through antenatal care, vitamin A supplementation to children under the age of 5, and the prevention and the treatment of acute malnutrition. We also have a crisis in the food systems, and that has caused food prices to go up, and the availability of particularly nutritious foods on the markets has been reduced. And then we have an economic crisis on top of all that has caused incomes to fall. So all of this had severe implications for the quality of the diets that children can consume and for the delivery of essential nutrition services.
Okay, let's talk numbers. Can you describe the forecasted impact of COVID-19 on child malnutrition and child deaths?
Yes, before this crisis, we had 48 million children that were wasted. We have projected that an additional 6.7 million children under the age of 5 would become wasted this year alone. So that is in 2020. And that's an increase of 14%. And that's an increase that we really haven't seen during this decade. And in addition to that, wasted or acute malnutrition, that's a low weight for height, is an important cause of child deaths in the world. We also see an increase in child deaths under the age of 5. It's an estimated 130,000 in 2020 alone. And that would mean 10,000 children per month in this year alone who would die due to COVID-related increases in wasting and disruption of delivery of these essential nutrition services.
I imagine most of our listeners are familiar with the term wasted, but when you say a child is wasted, what exactly do you mean?
With wasted, we mean that a child is too light for its height, so it's a low weight for height. This is an acute form of malnutrition, and because when it is quite severe, it's actually immediately life-threatening, and these children need to be treated. It can also be moderate, and then children can suffer longer-term consequences. And I think that's also the reason why we are so concerned about this increase, because we know it's just the tip of the iceberg. First of all, this crisis will last for longer. We will see other forms of child malnutrition increase, and we are currently projecting what this means for the immediate years to come. So to give you an example, mothers that are pregnant now, when they suffer the impacts of the COVID crisis on their nutritional status, they will deliver babies that are born low birth weight and that are themselves at higher risk of developing stunting in the next coming 2 years. But we also will see an increase in micronutrient deficiencies, micronutrient malnutrition. And all of this will have impacts for children in the future and for the next generations as well. When children are malnourished early in life, this affects their cognitive development, it will affect their school performance, and eventually their future productivity as an adult. It will also affect their nutritional status and their disease risk as an adult. And eventually, when these children who are malnourished now will turn into women, they have a higher risk of delivering children with low birth weight again. So that's why the next generations are at stake as well.
And does the increased child mortality primarily from the children being too weak to fight off diseases they may have been exposed to anyway, or are there new things that come into the picture?
Almost half of all the children's deaths are due to child and maternal undernutrition. We knew that already before COVID. So with an increase in child malnutrition, we can to some extent also expect this increase in children's deaths. We also now see a disruption of essential nutrition and health services that are affecting child mortality. In many countries, vaccination programs have been suspended, growth monitoring and promotion programs, and essential services such as vitamin A supplementation that are directly also related to child mortality have been suspended, as well as, of course, the promotion of breastfeeding practices. All of this impacts the child's nutritional status and also its ability to fight off infectious diseases. And in many of the low-income countries, these are the common infectious diseases such as diarrhea, measles, that are the biggest killers among these children.
Thank you. Those are several of the best explanations I've heard of a definition of wasting, and then also what puts a child at risk for mortality and morbidity. So thank you for that. So Saskia, you're a champion of nutrition-specific and nutrition-sensitive approaches to evidence-informed policy. So let me ask you this. Knowing what we now know about the impact of the pandemic on child nutrition and development, how can we overcome this crisis and build back even better?
Yeah, so I think, as you rightly say, we need a combination of nutrition-specific and nutrition-sensitive interventions now. And we always knew that we needed that, but particularly now with this crisis being not just a crisis of the health systems, but also of the food systems and an economic crisis, we really need countries to step up efforts. And that has been summarized also in a call to action that was published along with our paper by the 4 directors of the UN, of UNICEF, the WFP, WHO, and FAO. First, we need to make sure that families and children can keep access to safe and affordable diets. And that's at the moment is at risk. But for instance, we need to at least make sure that nutritious foods remain available on local markets and that the supply chains are not being disrupted despite maybe local lockdowns to mitigate the spread of the virus. That's one. And then second, we need to make sure that all these essential services that are being delivered through antenatal care or through child growth monitoring programs will need to be continued and even scaled up or intensified, while at the same time, of course, ensuring that health workers can deliver these services in a safe way. So they need to have adequate protection themselves. And then third, we need to ensure that we continue the detection and the treatment of child wasting. So the children that become acutely malnourished, they need to be treated. The provision of school feeding needs to continue. In many countries, obviously, schools were closed during lockdowns, and that meant that children were deprived from these essential additional meals. And if schools remain closed, we should look for innovative ways to deliver these additional meals to children. And then lastly, but not least importantly, is that we need to step up social protection efforts and make sure that they include nutrition. So for instance, that they include cash transfers or vouchers that families can use to buy nutritional foods on the markets.
With what you just said, you reminded me of several things that you mentioned earlier. One was that this is a complex problem, and second, that there are a large number of international agencies and organizations involved in addressing this. So is it possible to reach consensus on what should be done? I mean, is there agreement across the international landscape about how this should be approached?
Yes, and that's actually what we have achieved. And I think you see that across the board, that this crisis has also resulted in unique forms of collaboration that didn't really happen before. And we see the same here in nutrition, I think, where for the first time, actually, food systems, health systems, economists and nutrition experts have really come together and have said we really need to, first of all, identify what this crisis means for malnutrition in all its forms and for the next few years. And second, to speak with one voice on what we think needs to happen now in order to, as you say, mitigate these impacts. For the longer term, when we need to build back better, we really need to invest in sustainable and resilient solutions to make food systems more resilient for these type of shocks in future, to make sure that health systems are not going to be disrupted to the extent we have seen in this crisis. And having said that, mind you, that there's many countries out there now that are really making enormous effort of restoring some of these services. But I think we have to make sure that it doesn't happen again. And these type of unique collaborations really should continue even when this pandemic is over, because that's the only way we can tackle such a complex issue. So in that regard, COVID has accelerated this type of innovative collaboration.
So what are the implications now and also in the future if we don't act?
Yeah, so the implications are if we don't act that we really lose an entire generation. And that sounds very dramatic, but I think that most of us who have worked in nutrition for decades have never really seen such a rapid projected deterioration. And I think if we don't act now, we run a risk that we lose the progress that we've made in the last 2 decades. And for these generations of children that are being born now, there's no time to waste, because we also know, as I just explained, that the nutrition in the first 1,000 days, so basically during pregnancy and the first 2 years of life, is determining the future of these children. It will eventually determine the GDP of countries. We know now that malnutrition can cause several percent points of a country's GDP per year. These children in the future will have a higher risk of having chronic diseases and obesity in life. So it's really a generation social capital that is at stake here.
Well, thank you so much. You've done a magnificent job of bringing attention to a very dire situation and showing how widespread the problem is, how it could grow even worse, and what the consequences could be. So I'm very grateful that you could join us. So thank you so much.
You're welcome. Thank you.
Our guest today has been Dr. Saskia Osendarp, Executive Director of the Micronutrient Forum in Washington, D.C. And thank you for listening. If you would like to subscribe to the Leading Voices in Food podcast series, you can find it on Apple Podcasts, Google Play, or your favorite podcast app. Podcasts and transcripts are also available on the website of the Duke World Food Policy Center. I'm Kelly Brownell.